Good morning, everyone. My name is Dr. Chitra Menon. I am your Medico Pathology faculty, and today we'll be dealing with a few questions that has already been given to you as a part of a test. As you know, we have two sessions, one today and one tomorrow, both live sessions, and you have already been given PDFs containing the questions. So here, I have a couple of advice for you. First thing is, you already have the PDF. So please write along with me in the PDF. It is always better to learn by writing. And secondly, even though if it is a question, you feel like the question is too simple, just understand that by each question, what we are actually expecting you to learn or what we actually want you to learn is about some fact or some information regarding each question and each topic. So each question will be about a specific topic and I'll be dealing with a few points regarding each topic. So without any much ado, we'll begin. So you have your first question. Which of the following lipids is predominantly present in the myelin sheath of neuron? So here, before we begin, I have to say that we are now talking about myelin sheath. So with this question, I would like to bring the discussion to the plasma membrane, okay, because it is a topic that has been frequently asked. So, when you are talking about the plasma membrane, you have to understand that it is a bilayer, a lipid bilayer. Okay, so you have some phospholipids that are making up the plasma membrane, and this is how it looks like, the phospholipids. So here you have a hydrophobic head. Hydrophobic means water hating, and after that you have a hydrophilic head and a hydrophobic tail. Hydrophilic means water loving head and a water hating tail. So this is your cell and this is your cell membrane. So here you have the inside of the cell and here you have the outside of the cell. So as you know, your plasma membrane is a bilayer and it has an inner layer and an outer layer. Now again, I'm going to give you the names of a few compounds that are present in the inner layer and the outer layer, because similar to this, your question is going to be, you'll have a list of compounds that are present in the plasma membrane. You may be asked which is present on the inner layer, which is present on the outer layer, and what is the function of each chemical or each molecule that is there which is forming the plasma membrane. So as I said, this is your cell, this is the inner part of the cell membrane and this is the outer part. So in the inner part you have two compounds that you need to know of. First one is your phosphatidyl ethanolamine, and your second one is your phosphatidyl serine. So two compounds that are present in the inner wall of the plasma membrane. You have your phosphatidyl ethanolamine and phosphatidyl serine. Okay, now we are moving on to the outer part of the membrane. So again, in the outer part of the membrane, you have three types of molecules. The outer part means the part that is facing outside the cell, that is to the external environment of the cell. So that is your glycolipids. Then you have your phosphatidyl choline, however you like to pronounce it, sphingomyelin. Okay, So in the outer layer, again, you have 3 molecules, that is your glycolipid, then your phosphatidylcholine and your sphingomyelin. Now, you also have some compounds that are present both on the outer side of the membrane and the inner side of the membrane. So that is, you have two, that is your phosphatidyl inositol and your cholesterol. Okay, I hope that is clear. So, again, I said there are, these are the common compounds that are present in each place. Out of this, again, another question that you may be asked is about So, carrying on, I told you these are the various compounds that are present on the plasma membrane, on the inner side, on the outer side, and both the sides. Out of this, a very commonly asked question is about your phosphatidylserine. So, this phosphatidylserine, what happens is, it is usually present on the inner side of the plasma membrane. So, this is your phosphatidylserine molecule. That is, this is your serine molecule which is usually present on the inner side of the membrane. Now, during apoptosis is your programmed cell death. So, during apoptosis, what happens is this serine compound that is there on the inner side, it flips to the outer side. Okay, so your serine compound, you now have it in your inner side. It is going to flip to the outer side. And this compound is now essentially functioning as a signal. Like a signal saying, eat me. So, the phosphatidylserine, which is there on the inner part of the plasma membrane, it flips to outside and acts as an eat me sort of signal. That is, it is signaling the macrophages that come and eat this cell, come and eat this cell. The function of this cell is over. So, now we need to kill this cell. So, that is about phosphatidylserine. So, again, this is about your plasma membrane. Then again, in your plasma membrane, you have so many types of channels that are present. For example, you have something called a lipid raft. That is, you have a lipid raft. As the name suggests, at the portion of this lipid raft, it is almost a gel-like consistency so that there can be a better passage of molecules like your cholesterol and your glycosphingolipids through the cell membrane. Okay. So, we were talking about the plasma membrane, and when we are talking about the plasma membrane, few things you need to know about the plasma membrane. That is, it is a lipid bilayer, that is a phospholipid bilayer, and these phospholipids, they have a hydrophilic head and a hydrophobic tail. Okay, hydrophilic head, water loving head, and a water hating tail. So, this plasma membrane is a bilayer and you have several proteins or rather molecules that are present either on the inner surface or on the outer surface or throughout, that is through in both the inner and outer surface. Now, talking about the inner surface, the two things that you have are your phosphatidylethanolamine and your phosphatidylserine. Out of this, your phosphatidylserine is important because during apoptosis, this phosphatidylserine is the protein molecule that flips. That is, it is present on the inner surface, it moves to the outer surface, and it acts as a eat me signal, signaling the need for apoptosis for that particular cell. Similarly, in the outer membrane, you have glycolipids, then you have your phosphatidylcholine, then you have your sphingomyelin. Then on both inner and outer surface, you have phosphatidylinositol and cholesterol. So that is about the, that is in very short the structure of the plasma membrane and the commonly asked question regarding the structure of the plasma membrane. Okay, now again, you know, the function of the plasma membrane is protection of the cell from the exterior environment, but a cell cannot survive by itself. Like, it needs some factors from the external environment for it to survive, some nutrition, some water, and things like that. So we will see how this sort of things move across the plasma membrane. So when you are talking about plasma membrane transport, broadly speaking, it can be divided into two, passive and active. And as the word suggests, active is when ATP is required to transport something from inside the cell to outside or vice versa. And passive is when there is no need for such ATP. So this passive can be by symbol diffusion. That is, cells like molecules, they just diffuse along the plasma membrane. Then you can have some channel proteins, that is, in the plasma membrane you have some spaces which are like gates. Your gates are your channel proteins are your gates, and this gate can allow the movement of particular substances. So you have different channel proteins for different substances. And then you have your carrier proteins as well. Okay. And when you are talking about your active transport, the most common example that comes to your mind is your sodium potassium ATPase pump. And similar to that, there is also another pump that uses ATP that I want you to know, and it is a frequently asked question again. That is your MDR protein pump. So what does your MDR stand for? If as most of you may already guess by now, MDR stands for multi-drug resistance. So the function of this MDR protein pump is that it pumps polar molecules. That is, it pumps your chemotherapeutic drugs from inside the cell to outside, essentially acting as a resistance to that particular drug. Okay, so again, active transport, the most common one is your sodium potassium ATPase, which everybody knows. The next one that is asked is your MDR protein pump, which stands for your multi-drug protein pump. And the function of this multi-drug protein pump is that in neoplastic cells, there is this MDR pump, and it pumps out the chemotherapeutic drugs from inside the cell to outside, so that it cannot work, and thus acting as resistance to the action of this chemotherapeutic drug. Okay. Then again, when you are, that is about the types of transport. Then again, there are a few words which are very confusing that I want you to know. The first one is endocytosis. What do you mean by endocytosis? Now, endocytosis it is the uptake of fluid or macromolecules into the cell. So that is your endocytosis. Next word is pinocytosis. Now this pinocytosis, in common term we can say it as cellular drinking. And here what is happening is fluid is taken into the cell or outside the cell, into the cell, that is cell is drinking fluid, that is pinocytosis. And then you have phagocytosis. So what is phagocytosis? Phagocytosis is, as you probably guessed, cellular eating. Okay, so here what is happening? Here macromolecules are taken into the cell. Now another thing of phagocytosis is we use this word commonly when we are describing cells like your neutrophils and your phagocytes, that is your macrophages, because these are the cells that usually digest other cells. Okay, now if there is an endocytosis, which is an uptake of fluid or macromolecules into the cell, there also has to be an exocytosis. Like if something is taken in, it has to be taken out as well. So exocytosis now this is when macromolecules are exported out of the cell. So endocytosis is when molecules are taken into the cell, and exocytosis is when molecules are taken from the cell to outside. Okay. Then again you have another word called transcytosis. Now what is transcytosis? Now as I said, this is your cell. Now when there is a when you're talking about a cell will have an apical portion and a basolateral portion. Okay, so when substances are taken between the apical and basolateral portion of the cell, it is called transcytosis. Here what is happening is you have transport of molecules between the apical and basolateral component. Okay, so again here this is your cell. When it is taken in, it is called endocytosis. When it is taken out, it is called exocytosis. And this movement from one part, that is from the apical part to the basolateral part, that is called your transcytosis. Okay, I hope that is clear. Now again, when you are talking about your endocytosis, that is when molecules are taken into the cell, it is of two types. That is either a caveole mediated endocytosis or a receptor mediated endocytosis. So here why I am talking about these kind of things is because these are all potential questions. So endocytosis, you know what is meant by endocytosis. Something is taken into the cell. Now it can be taken into the cell by two ways, either by a receptor or by something called a caveole. So this caveole, what is happening is, if this is your cell your cell is going to have some pits like this, and inside that pits you will have your caveolin protein. So once the molecule comes, it will attach to this caveolin protein and then it will get into the cell, and from the cell, through a process known as podocytosis, these molecules are taken in. Okay, again here you have a cell. Inside, like on the cell membrane, you have pits, pits that are coated with a protein called caveolin. So when a molecule comes, this molecule is taken in to the cell by the caveolin line pits by a process called podocytosis. Now this podocytosis is also called cellular sipping. It is like a macromolecule comes, it's like the cell is taking a sip. So it is called cellular sipping. Okay. Now this caveoli mediated endocytosis, here usually it is seen in cyclic AMP mediated proteins or your GPI related proteins or your SRC related proteins. Okay, so that is it about caveoli mediated. Now, in clathrin mediated, what is happening is here also you have in receptor mediated, here also you have a cell and you have a pit. But here this pit is coated by something called clathrin. Okay, so when again here what happens is you have a molecule that is coming in. So here this clathrin coated pits, the clathrin gets lost. So now you essentially, the clathrin is lost and you essentially have the formation of something called an early endosome, and then from the early endosome you have a late endosome, and after that endosome ruptures and releases the contents. Okay, so an example of a substance that follows this kind of clathrin based is your LDL receptor for cholesterol, and another is your transferrin receptor for iron. Okay, so here we were talking about the plasma membrane. In the plasma membrane, we discussed what are the different types of molecules or chemical compounds that are present on the inner surface of the plasma membrane, on the outer surface of the plasma membrane, and on both inner and outer surface. Here, a very important question is about the phosphatidyl serine, which is present on the inner surface, and it essentially flips during apoptosis and acts as an eat me signal. Then again, how things, we discussed about how things pass through your plasma membrane. Now, it can either be by a passive process or it can be by an active process. Now, in that active process, that is ATP is used, and the most common example is an ATPase pump. Another important pump that uses ATP is your MDR pump, that is the multi-drug protein pump, and essentially what it does is it removes all those chemotherapeutic drugs from inside the cell to outside. So that is your MDR protein pump. Now then when you are talking about passive sort of sort of transport across the plasma membrane. You have simple diffusion, then you have channel proteins, and you have carrier proteins. Then we'll discuss some words which are very confusing. So first is endocytosis. Anything that is taken into the cell, endocytosis. Anything that is taken out of the cell, exocytosis. And inside the cell, when it moves from one part of the cell to the other part, it is called transcytosis. Then again, two words, pinocytosis and phagocytosis. So pinocytosis is when fluid molecules are taken in, and phagocytosis is when macromolecules are taken in. Then again, endocytosis is when something is taken into the cell. Here you can have it in two types, that is something called a caveole mediated endocytosis or a clathrin mediated endocytosis. So your caveole mediated endocytosis, essentially what happens is you have a protein called caveolin, and it is coated in a pit on the surface of the plasma membrane, and the molecules are taken up by this pit, and that process of taking up of molecule is called podocytosis, also called cellular sipping. Then you have the receptor mediated, which is usually clathrin bound. So you have a pit which is lined by a protein called clathrin, and once the molecule comes, this clathrin coating is lost, and it gets into the cell in the form of endosomes, and it is transported. Example of this is your LDL receptor for cholesterol and transferrin receptor for iron. Okay, so this is in short about plasma membrane. So here, which of the following is found in myelin sheath of neurons? So here the answer is phospholipids, and this is just one of those type of questions that you have to know of. Now myelin. Myelin, what is myelin? Myelin is a protective protein that is present along neurons. So here if you have a neuron, this is your neuron, this is the axon, and this is the cell body, and this is the axon. So here you have cells called the Schwann cells, and your Schwann cells are what produces your myelin, and myelin is a compound that is helpful in conduction of electrical ions across neurons. Okay, and myelin is a phospholipids. So now we have with this question, I hope you've got a rough understanding of what comprises the plasma membrane and what are the commonly asked questions that you can get from the topic of plasma membrane. Okay, now we'll move to the next question. So now next question is about the membrane attack complex. Okay, so here again we are dealing with what is called a cytokine. So with this question, what we are discussing is cytokines and chemokines. Okay, which are both inflammatory molecules. So what do you understand by the word cytokine? So a cytokine, it is essentially a protein. It is essentially a protein that has been secreted by an inflammatory cell, and the function of this protein is to aid in inflammation, that is to cause more inflammatory damage. So these are proteins produced by inflammatory cells and having a role in the inflammatory response. Okay, so here what I want you to understand is, in any situation that a patient is going through, suppose it be a wasp bite, or suppose it be a fever, or suppose it be a malignancy, there are always cytokines in action. And when you are talking about cytokines, you have so much of cytokines, that is, there are several types of cytokines that you need to know. But for your purpose, we will learn cytokines under small topics. That is, first you have cytokines involved in acute inflammation, and then you have cytokines involved in chronic inflammation. Okay, so in acute inflammation, you will have something called TNF, that is your tumor necrosis factor. Then you have your interleukin 1. Here it is fever causing. Then you have your interleukin 6, which causes systemic effects. Then you have your interleukin 17, which is causing recruitment of neutrophils and monocytes, and you have your chemokines. Okay. Then in under chronic inflammation, you have your interleukin 12, which increases interferon gamma. Then you have your interferon gamma and your interleukin 17. Okay. So these are the different types of cytokines. Now, similar to cytokines, you also have another system called a complement system. So this complement system consists of plasma proteins called complements. Now, similar to your cytokines, your complements are also proteins that cause inflammatory effect. So when you are talking about complement system, you can say that it is a collection of plasma proteins that function in host defense. Okay, so this defense may be against any pathogen, this defense may be against a tumor, it may be anything. So when you're talking about complements, you have complements which are labeled from C1 to C9. That is, essentially you have something called around 20 different types of proteins. So now we'll take a look at the complement system. So your complement system essentially has three pathways. That is, you have a classic pathway, you have an alternative pathway, and you have a lectin pathway. Okay, so here what is happening is, essentially when you are talking about like complement system, you can say it is similar to a kind of war that is being waged. Okay, so in a war you have different components, like you have similar, if you are taking now that chess is in a very that in Indian chess is in such highlight these days. When you're talking about chess, you have something called, you have the king piece, you have the queen piece, then you have the rook, you have the bishop, then you have the horse, that is the knight, and then you have the pawns, which are soldiers. So your complement system is like soldiers. So these soldiers, if they get interested to fight, that is, if they are motivated to fight, they go and cause a lot of destruction against whichever country or whichever portion of people they are fighting against. So your complements are like your warriors. So to motivate the warriors or to activate the complement, you can have three pathways: classic pathway, alternative pathway, and lectin pathway. Now, all of these pathways, essentially what happens is you have a C3, that is cleavage of C3 complement. Like all paths lead to Rome, all these pathways lead to complement action by hydrolysis of C3, which is a complement. So we'll see each of the pathways. So in classic pathway, what is happening is you have something called a C1 complex. Just understand that the C1, C2, C3, C4, these are all complements and they have been numbered from C1 to C20. Sorry, C1 to C9, and there are about 20 different types of complements. So, in classic pathway, what is happening is you have something called a C1 complex. Now, C1 complex, any antigen, let it be a bacterial antigen, let it be a fungal antigen, whatever it may be. Once the C1 complex is getting switched on by the antigen, a cleavage is occurring. So, what is the C1 complex? Consists of something called C1QRS. Now, once this is getting activated, what happens is you have other complement proteins that are getting hydrolyzed. So, you have your C4 that is becoming your C4A. You have your C2 that is becoming your C2B. So, now think what all are left. You have a C1 complex, and along with that C1 complex you have C4. Now C4 has been hydrolyzed into C4A and C4B. C4A has a lot of functions which we are not concerned with. So it will have C4B is left. Again, C2 has C2A and C2B. C2B has other functions. C2A is left. So now you have C4B and 2A, and this is what is called as your C3 convertase. Okay, so here what is happening is now the C3 convertase, it is an enzyme that is formed, and the C3, now C3A is being removed, and what is left is your C3B. So now you have a compound wherein you have C4B, 2A and 3B. And this particular compound is called your C5 convertase. Okay. So then what is happening? C3 convertase hydrolyzes C3. So C5 convertase will have to hydrolyze your C5. So again, C5 is getting hydrolyzed to C5A and C5B. Now the C5B, it goes and combines with your C6, your C7, your C8, your C9 and forms what is called as MAC, that is membrane attacking complex. So I hope that is clear. You don't have to worry, it is not that much complicated. Just think that, or in whatever pathway it is, C3 has to get activated. So whether it be alternate, whether alternative, whether it be classic or whether it be lectin, all roads lead to Rome. So all activation has by all of these methods, C3 activation has to go on. So first in classic pathway again I am writing, you have C1 complex. Now the C1 complex cleaves your two types of cytokine, that is your C4 and C2. Now the C4 gives off C4A, so C4B is left. Now the C2 gives off C2B, so C2A is left. Now this is what is called your C3 convertase. And As the name suggests, this C3 convertase converts C3. Okay, it converts C3 into C3A. So what is left? You have the same thing, that is C4B 2A. Along with that, now you also have 3B. Now this is called your C5 convertase. And as the name suggests, what does the C5 convertase do? It activates the C5 into C5A and C5B. Now the C5B, this goes and attaches with the C6, C7, C8 and C9 and forms what is called an MAC, a membrane attack complex. So what this MAC does is, suppose this is your bacterial cell. Here you have your MAC, that is your membrane attack complex. So essentially it is like this MAC, it is like a a helicopter or a fighter plane that just comes into the cell and destroys everything inside the cell. So that is your MAC. Okay. So that is it about the classic pathway. Now, when you are talking about the alternate pathway, in alternate pathway, what you have to remember is your first step, that is your C1, your C4 and your C2 do not act. Okay. So from C3 onwards, you have something that is, here what is happening is you have some substances like cobra venom, then some antiserum. All of these goes and directly activates your C3. So what is happening? Your C3, here as you can see, in C3, you know, C3A goes and gets at C3A goes and has other functions. C3B is what is left. Now your C3B, this combines with your, just a minute, your C3B, this combines with what is called a factor B and forms C3 convertase. Okay, so now that C3 convertase is there, rest it is similar, that is C3 gives off C3A and this C3 convertase, here what is left is your C3B and your C3B and whatever complex that is there, that is the B, factor B complex, that causes your C5 convertase and your C5 convertase gives rise to C5A and C5B, and the C5B goes and converts and attaches to C6, C7, C8, C9 and causes the formation of MAC. Okay. So in alternate pathway, your C1, your C4 and C2, that is the first step here. This much portion is not taking place in alternate pathway. That is it about your alternate pathway. And then in your lectin pathway, what is happening is you directly have your C3 in lectin pathway. Your C1 is not taking place. That is your C1 is not active. But you have your C4, C2 which goes and binds, goes and cleaves C3A and rest of that takes place. So in a nutshell, if you are asked, just learn the classic pathway and just think that in alternate pathway, your C1, C4 and C2 are not taking place. In lectin pathway, your C1 is not taking place. So that is it about the complement system. Now again, when you are talking about the complement system, there are a few factors that help in the proper action of the complement system. Now the first one is something called a DAF, that is a decay accelerating factor. Now your DAF is present on the pathogen. Okay, so if it is present on the pathogen, what do you think the function is going to be? As I said earlier, in complement pathway, all pathways converge at C3. Now, as far as the pathogen is concerned, if the C3 pathway works, what is happening? The complement system is getting activated and the pathogen will be killed. So, the pathogen has developed this factor called DAF, that is the decay accelerating factor, and it prevents the formation of C3 convertase. So that is the action of your decay accelerating factor. That is, it prevents the formation of C3 convertase. Similarly, you have other proteins like CD59, then proctin, then MAC inhibitor proteins, which are all present on the pathogen to react against the formation of this complement pathway. Okay, so here again, important question is some of the deficiency, so some diseases which are associated with a deficiency of specific factors. So here, C1 esterase deficiency causes what is called your hereditary angioneurotic edema. Okay, then I told you earlier about your DAF. So your DAF or your CD59 deficiency, that causes what is called the PNH, that is paroxysmal nocturnal hemoglobinuria. Then C1, C2, C4, the first three factors in classic pathway, deficiency of that causes SLE-like symptoms. So, also your C3 deficiency causes severe pyogenic infections. Then your C5 to C9 deficiency, that is your terminal complement factor deficiency. This causes Neisseria infection. Okay. So that is it about complement. Then again I am telling you, very simple complement. There are three pathways. All three pathways converge at C3. In classic pathway, what is happening is you have C1, C1 complex which cleaves C4 to C4a and C2b, and what is left is your C4b and C2a, which is the C3 convertase. Now this C3 convertase converts C3 to C3a and C3b. Now C3a goes and acts as an anaphylatoxin, while your C3b combines with the above complex to form C5 convertase. Now your C5 convertase, what happens is C5 is hydrolyzed to C5a and C5b. The C5a is again an anaphylatoxin. And your C5b, it combines with your C6, C7, C8, CN9 and causes membrane attack complex. Okay, MAC. Now, other two pathways, your alternate pathway and your lectin pathway. In alternate pathway, your C1, C5 C4 and C2 are not taking part, and then in your lectin pathway your C1 is not taking part. Okay, then again when you are talking about the anaphylactic properties, I said C5a, whatever that is left from here, all these things, they are acting as anaphylatoxins. And when you are talking about the anaphylactic ability, C5a more than C3a more than C4a, that is anaphylatoxin. Okay, so that is it in a nutshell about the complement system. So now let's take a look at the question. Which of the following is a part of membrane attack complex? The answer is C5b. Okay. So next question. Which of the following statements regarding the given pigment is incorrect? Okay. So what are we dealing with here? If you look at the picture, you can see, what do you think this tissue is? If you remember from your, I don't know, biology classes, your myocyte is something that is arranged like this. That is your cardiac myocyte, right? So this is your cardiac myocytes, which are striated cardiac muscles. And you have striations and you have internodes. Now here you can see something. You can see the presence of a brown, or rather a golden yellow colored pigment. What do you think that pigment is? So, which of the following is incorrect? So, this pigment is your lipofuscin. And with that, we are coming to the next topic, that is intracellular accumulations. Okay. So, normally in a cell, what all factors are getting accumulated in a cell normally? Normally, there are nothing that is getting accumulated in a cell. But in several pathological conditions, so many types of molecules are getting deposited. So why do you think these kind of molecules are getting deposited? So it can either be because of inadequate removal of a normal substance that is present inside the cell, or it can be the substance that is present inside the cell. For this inadequate removal, the example is fat. That is, you have fatty change or steatosis. Now, the second one is by defect in folding or packaging of a protein. For example, your amyloidosis protein, that is your amyloid protein, or your alpha-1 antitrypsin. All of these, if the protein that is formed is defective, it cannot be further synthesized, so it accumulates inside the cell. Then, third one is, in case of lysosome, you have something known as lysosomal storage disorders. So here, the lysosomes fail to degrade whatever substance that is there inside, and hence it results in lysosomal storage disorders. So now we will see which are the common things that are getting accumulated. So just imagine, what do you think are the common substances that are getting accumulated? So the first one is your fat. Now, whenever fat gets accumulated somewhere, it is called steatosis. Now, where do you think fat is normally getting deposited? If you said liver, you are correct. Other organs are your liver, your heart, kidney, and muscle. Okay, so that is it about fat. Then second thing is cholesterol. Cholesterol and its various esters, cholesterol esters. Now here, When cholesterol is deposited in the blood vessel, it is called atherosclerosis. Then you have something called xanthomas. So essentially in xanthoma, what happens is in the skin and in the subcutaneous tissue, cholesterol and its esters are getting deposited. So that is your xanthoma. Then you have another word called just a minute. Cholesterolosis. Cholesterolosis. Here, it is a particular type of cholesterol deposition wherein you have cholesterol laden macrophages in lamina propria of gallbladder. Okay, so that is it about cholesterol. Then moving on, protein. Now, here when you're talking about protein deposition, it can be in the form of neurofibrillary tangles that are commonly seen, that are cases where protein is getting deposited inside the brain, and this is usually seen in your Alzheimer's disease. Then in alcoholic liver disease, you have something called a hyaline bodies that are getting deposited. That is it. Then you also have something called a Russell body. So this Russell body, what happens is, protein synthesis takes place in the endoplasmic reticulum. And that protein that is there in the endoplasmic reticulum, so for one reason or the other, it is unable to be excreted out of the cell. So these proteins, they stay inside the cell and cause formation of Russell bodies, which are essentially eosinophilic materials. Then you have glycogen. Now, glycogen storage disorders is another part of glycogen storage disorders is a very common topic, and here glycogen is getting deposited. Now, let's come to pigments. What are the different types of pigments that are getting deposited? So, it can either be an endogenous pigment or it can be an exogenous pigment. So, exogenous pigment, what do you think is the most common exogenous pigment? If you said carbon or anthracosis, carbon or carbon-like substances, you are correct. In your lungs, you commonly have what is called as anthracosis. So here what is happening is you have different carbon compounds that are getting deposited. Then again, when you are doing some tattooing, you have the dye which is used in the tattoo that can also get deposited. This usually happens in the lymph nodes. Now, when you're talking about endogenous pigments, you have lipofuscin. Now, lipofuscin is your wear and tear pigment. And thing about lipofuscin is it is a yellow to brown lipid, and it is usually perinuclear in position. That is, if this is the cell and this is the nucleus, this near the nucleus is where you will find the lipofuscin. Similarly, you have other proteins like melanin, which is usually seen in melanoma and also in alkaptonuria and alkaptonuria. Then you have hemosiderin that is seen in chronic venous congestion, which is essentially iron that is getting pigmented. So now let's take a small break.